When I have a patient, especially a new patient, I think it starts from the basics, getting to know the individual, not just their injury and their symptoms, but I really take an interest in how the symptoms came about. Sometimes I also want to know a lot about the background of an individual, especially their work history, because that can influence the type of surgery we do, sometimes whether or not we do surgery. But it really starts from the very basic things. And then I have to kind of switch gears because I have such a varied practice dealing with not just spine and some of the trauma things, but also some of the conventional things that a lot of us experience in life, which is arthritis of the hip and the knee. I start to cater my questions toward that. My general philosophy, once I've gotten to know the patient and the nature of their problem, is of course to start with conservative measures. I think that's really something that this group in particular is known for, not just being people that turn to surgery as the first option. I'm very pleased to say that we have a very good physical therapy center here, so a lot of these injuries and some of these aches and pains, especially with the spine, for instance, can be rehabilitated through exercise and activity and modification of certain lifestyle choices. We can make people better. So I try to assume the role of a doctor more so than just being a surgeon when it comes to my patients. The term holistic medicine is used, and that's not traditionally applied to our field, but I do think there's something to be said for looking at the individual as a whole. My practice really takes two forms, and I think a lot of that has to do with my trauma background, but a significant portion of my patients will be those that I encounter for the first time in the hospital. And oftentimes they will have arrived to the hospital by way of an ambulance or some type of medical transport because they're not there by choice. I mean, injuries, we like to say, don't happen by appointment. You know, something happens, and someone sometimes can have very devastating injuries, many of which can involve the orthopedic system, which is where I and some of my colleagues will come in. So those will be some patients that I take care of. And the thing that I should say that I really enjoy about that, going back to the point about being holistic, is that many times trauma patients have to be looked at in that fashion. It's not just a broken bone, but it's also what's going on with their lungs or their heart. Did they have a head injury? So there's really a multidisciplinary approach, not just the orthopedic surgeon, but a trauma surgeon. Sometimes a general surgeon or a neurosurgeon will be involved in the care. So it's a very collaborative effort, and I always like being part of that in order to piece people together and get them back on their feet and hopefully restore their life. So that's a very satisfying thing to do. The second part of my practice is the more conventional one, which is being in the office and opening our doors to new patients. And orthopedic injuries are exceedingly common. You don't have to talk to an orthopedic surgeon to realize that. As it turns out, the second most common reason that people will see their primary doctor is usually for an orthopedic type of injury, a musculoskeletal problem. Often it's just back pain or other aches and pains. So we're well versed in handling that. But the patients that I see here, I think going back to what we've discussed, it's about getting to know the nature of the problem, the severity, and how it's impacting their life. Because as orthopedic surgeons, that's what we pride ourselves on, is getting people back to the point where they were before, restoring people's health and their activity and their function. That's really the emphasis of what we do, and really one of the joys that comes from being an orthopedic surgeon.